A Missouri hospital system said this week it will no longer prescribe Plan B following the Roe v. Wade decision. Tonight, we're looking into what the Missouri state law has to say about emergency contraception. Thanks so much for joining us. I'm Kelly Jackson.
And I'm Mike Bush. St. Luke's Hospital System in Kansas City made the announcement on Tuesday saying the law is, quote, ambiguous. 5 on your side's Elise Schoenig joins us now in studio with some developing news on all this. Elise?
Yeah, within the past 90 minutes, St. Luke's Hospital reversed course, saying it will now provide Plan B to its patients. Now, the Kansas City Health System changed its mind after clarification from the state attorney general and governor. Both say the newly passed Missouri law that makes abortion illegal in almost all cases does not affect emergency contraception.
Contraception is different from abortion.
St. Louis University law professor Sydney Watson says a lot of questions remain after Roe v. Wade was overturned Friday, but this concept remains clear. After St. Luke's Hospital in Kansas City announced Tuesday it would stop providing contraception, then reversed course Wednesday afternoon, Watson says this kind of response is expected.
So I don't think we should be surprised that hospitals and providers are trying to figure out where the line is. I think the line is pretty clear.
She says while some of this may be knee-jerk reactions, the law is still clear.
I read the law and I see that there's a definition of abortion that doesn't reach to contraceptives.
Both Governor Parsons' administration and the Missouri Attorney General's office appear to agree. Each said Wednesday that the so-called trigger law in Missouri does not affect emergency contraception. Meanwhile, Watson says we need to give our healthcare providers a fair chance to wrap their heads around what this change in law means and how it affects their practice. Although, she says not all patients have this time.
I think that is tragic for women. I don't think it is necessary. I don't think it is required by Missouri law.
Now, St. Luke's in Kansas City, which is aligned with the Episcopal Church, says it believes the law is still unclear. Now, it's important to note here this is a separate health system from the St. Luke's here in St. Louis. Now, I did still reach out to several hospital systems in the St. Louis area. BJC and Washington University School of Medicine confirmed to me they'll still continue to offer all forms of contraception.
The top prosecutor